Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency servicing Palm Beach County, Broward, and Miami-Dade. You can reach us directly at 954-717-7027. I am your host, Louise Gomez, and this evening I am delighted to introduce everybody to Dr. Manish Gupta. He is a board-certified sports orthopedic surgeon. He's right here locally in Deerfield. The address is 2001 West Sample Road, Deerfield, Florida. Also has a location, a satellite office in Boca Raton as well. You can reach him at 561-314-7200. The website is sportsorthocenter.com. Thanks for joining us today.
Hi, how are you?
I'm doing well. I appreciate you taking time out of your busy schedule and coming here and allowing us to pick your brain a little bit and learn a little bit more about a day in the life of an orthopedic surgeon.
Yeah, whatever little brains left at the end of the day, but sure,
Okay.
I'm here and trying to stay warm in this,
Oh, yeah.
unusually cold weather
It
for
has
us,
been chilly, yes. Kind of shocks the system a little, right?
Yeah, especially for those golfers and tennis players. Injuries happen when they're not warmed up.
So are those the main clients you have? I imagine you deal with a lot of sports injuries, is that right?
Well, I got to say, right now, it's pickleball. It's
Oh,
like the craze,
is
right?
that yeah, that's
It's got to be
true.
one of my top sports injuries that we're treating.
What kind of injuries are these people having? Is it ankles, knees? What
ankles, knees, elbow, a lot of tendonitis stuff, overuse, and sometimes that happens when, you are used to playing, but you don't have the same time to train and exercise and strengthen those parts of the body. And then all of a sudden you do something you love to do and you're out there and those, muscles and tendons, they don't act like they were when they were in your 20s and 30s and maybe in 40s. But when you get up there after 45, a lot of musculoskeletal overuse injuries can happen. So that's kind of what we see from pickleball. Which you can see in golfers, tennis, and we're a haven for those kind of sports down here because of the weather.
Because of the weather.
Maybe not right now, but most of the time.
Couple days when it warms up. So tell us a little bit about your background. Where did you go to school? What made you want to become an orthopedic surgeon? When did you just have that moment where you said, "I want to be a surgeon"?
Well, I have to tell you that when I was in 4th grade, I
love
wrote
it.
Autobiography about myself, and in that, and it said, what would your goals be? I actually put in there I wanted to be an orthopedic surgeon. So it came early in my life. I think I wanted to combine my passion for sports with whatever I did. And I'd always heard about orthopedics and orthopedic surgery. Never didn't know what it was at 9 years old.
Sure.
But I think over the years, I developed an interest in medicine. I wasn't going to be a tennis player, which was the first love, I think. But I moved from India to South Florida eventually, with a little stop in Pittsburgh. Went to grade school, middle school here in South Florida, and then ended up in high school in Coral Springs, and then went to college in Gainesville. So University of Florida.
Of course, great medical school there, huh?
I had the pleasure of meeting, the Hall of Fame running back from the Dallas Cowboys. What's his name?
Oh, nice.
Forgetting his name right now.
Emmett
Smith.
Okay.
Yeah, so he was a graduate of University of Florida.
Wow.
But anyway, then medical school at University of Miami, and then I did my training in orthopedics in New York and New Jersey at St. Joe's, Seton Hall University,
Nice.
and then fellowship in sports medicine in Baltimore at Union Memorial, where I had the chance to work with the Baltimore Ravens and a lot
I
of
was going to
sports
ask
teams.
you,
Yeah.
what sports teams did you work with? So you
We
worked
took care
with?
of a lot of sports teams.
Oh,
there, yeah.
very good.
Yeah.
And so what about down here? Do you see any athletes here that are in like D1?
Oh yeah, absolutely. Because when I
sports.
first started the practice, it was geared to that and all general orthopedics.
Mm-hmm.
But then I had the pleasure of being a FAU team doctor. So I was a team
nice.
doctor for all of their
Wonderful.
sports for about 10 years. And I was part of that program. And so that gave me a lot of experience that I had from the past, and
Sure.
and built it, and become part of the community. And I'd actually gone to FAU for a year between medical school and college, so it was nice to be part of that. And that family
Sure.
grew, and as the practice grew, a lot of those athletes that graduated came back, and we keep in touch. And
Very nice.
so that's been the fun part of being a sports orthopedic surgeon.
Yeah, I feel like it keeps you in that community of athletes where they're so passionate about what they do.
And I think that's a key point that
Yeah.
you bring up, is that passion, passion to get better,
Oh,
to
true.
be the best at something. And, I had that same mindset, maybe not as a pro athlete anymore, but, when I was getting into my profession, I said, everybody's an athlete. An athletic maneuver is your ability to do something at the highest level. So if you decide that you want to be a walker, you want to be a sprinter.
I like that.
Anybody can do that at any age. And we've seen that. People are pickleball champions at the age of 75.
Right,
and,
right.
playing tennis a lot longer. Golfers have senior, leagues and this and that. And even I used to take care of this basketball team for over 55-year-old
nice.
patients.
Uh-huh.
And they just loved to do what they did, and
I know.
and they wanted to be good at it. And if they had injuries, they took care of them, and they wanted to get better.
I feel like you have the best type, you would potentially have the best type of patients, because if they have the discipline to want to do well in sports, now if you prescribe to them a certain type of exercise or physical therapy or whatever, I feel like they'd be disciplined to want to heal that. Does that make sense?
I think it does, because in any treatment, you need to be disciplined.
Right.
You need to be guided by your doctor,
And motivated, right?
but you have to be disciplined and motivated.
Yeah.
That's something that comes from within.
Right.
And I think the athletes, I've been around at the highest level, they definitely display that. But I think it's our job as physicians, at least that's what I feel, that we can motivate, and we can
Right.
be, a beacon of information to get people to do that, so that they don't want to give up on those dreams of, to be active. As part of being a physician, one of the things you have to do is that you have to move to be healthy.
That's
So
right.
yes, I'm not a cardiologist, I'm not
Sure.
the brain surgeon, I'm not,
Right.
but I'm an important part of that.
Very important part of
realm,
that.
because it keeps the body moving. And if we can keep you moving, I think it will keep you healthier.
Absolutely.
So that's where musculoskeletal orthopedic specialists come in.
That makes sense. And so people listening right now who are maybe, they have something going on with a certain body part and they're maybe fearful to go in because they're thinking, okay, he's an orthopedic surgeon. How quickly is it, or, people maybe have the misnomer that, oh, he's going to want to, do surgery right away. What can you speak into about what your level of care would be? I mean,
So that's a myth.
Yeah.
Yes, I'm a surgeon,
sure.
but you take that scalpel with a sense of responsibility. If you look at the statistics, if you go to an orthopedic surgeon and you go see someone who's a specialist, less than 20% of the people are actually surgical candidates.
Okay.
On average.
Right. Good to know.
Now, you can go to a tertiary care center where they specialize in one little thing, and they may get referred from other orthopedic surgeons, and their
Sure.
surgical rates may be higher.
Makes
But when
sense.
you're in part of a community like I am, and you take care of the general population, and you take care of the elite population too, you look at things from a non-operative standpoint first. You always do. And and that's what those modalities that you've mentioned, physical therapy or
Yeah.
specific exercise programs can be prescribed first, and use of injections and different types of injections, like natural biologic injections versus and they get misnomered by like calling it stem cell therapy. There's no true stem cell therapy going on in the States. It's these are things that can be done that can give you the same effect. But as we know, our laws are a little bit different,
Sure.
and people go overseas to get some of the the true stem cell treatments. But what I'm saying is that there are non-operative ways to, first diagnose,
Sure.
get an assessment, and see what we can do without surgery. And then those cases where it's not working, then you have the expertise of that surgeon to go and say, okay, surgery is going to make you better. And I think that's something that you got to trust. And,
Sure.
and I think we, as orthopedic surgeons, want to get that trust from our patients that if we do surgery, you got the right patient, the right diagnosis, and they're motivated and disciplined enough to do the rehab and the recovery,
Right.
so they get the best outcomes.
Right.
And that's what you want to be able to achieve.
So when you say other alternatives, and you mentioned stem cell, do you do PRP, the platelet-rich plasma? Is that something
So
you
yes.
do?
So platelet-rich plasma, is not a stem cell.
Right. Can you tell the audience what a PRP is and how that works?
So basically, platelet-rich plasma is where your own blood,
Okay.
is concentrated and spun and it goes through a series of cycles where we concentrate out the platelets and the growth factors that are contained within that plasma.
Okay.
And those are then utilized in the appropriate way to help certain injuries, certain painful areas, because it has shown some benefit to reduce inflammation, to repair some soft tissue, and help in certain conditions.
Okay.
But I have to tell you that there's a lot of research still going on in that area.
Sure.
I believe in it. I think it works. But you have to use it properly. I think you have to be guided by the right
Sure.
techniques, and go from there. A lot of it is not FDA approved,
Okay.
but patients want treatments that are
they hear about it.
that are alternative
Yeah.
to because the fact of the matter is that you use too much steroids or too many drugs,
That's
they
right.
also can harm you. So you have to just be balanced in the way you approach those
Yeah.
those techniques.
So what other options are there for inflammation? I think we were talking prior to the show a little bit about turmeric. I think can you share with us the benefits of what turmeric can do for a person who has inflammation?
Well, it's funny you asked that because, being from an Eastern, culture, I had the opportunity to study and be part of that. And, Ayurvedic medicine is solely based on naturopathic drugs and
Isn't it amazing
techniques.
that what our ancestors knew thousands of years ago that are maybe taking us so long to figure out? I'm sorry to interrupt you, but I just had to ask you that.
That's exactly the point. This is a 5,000-year
Right?
discipline that's been studied and well established in a certain part of the world.
Right.
And I'm not the only person who advocates for this. There's
Sure.
Johns Hopkins, Harvard, you name the leading institutions, and they're all studying the effects and the positive effects of turmeric and how it's used. So I truly do believe in its effects,
Me
and but it's not going to take care of everything.
Right.
It has to be used properly, and I think I'm just lucky to be exposed to it. So the discipline and be around some PhDs and who've been part of the practice, and helped us discover how it can be used properly. So it's a discipline that's studied in the Eastern world, and we've used those specialists to help us, guide us, and say how can we use them in musculoskeletal conditions and things like that. As a matter of fact, we've done some basic science research within the practice. We've done some clinical research within the practice.
Okay, good.
To look at the effects of turmeric and its the way it's used and how it can help. And as you know, the state of Florida put a mandate out that you needed alternative to pain medication rather than just oxycodone and Percocets and
Right.
all those things, because that led to a big
Problem. Yeah.
firestorm of problems.
Yeah.
So I just think that the timing is right. I think patients are also more educated.
I agree.
We have the ability to learn from other cultures and other techniques. They ask you these questions. So I feel blessed that I have the ability to talk to them about it and talk about the pros and cons as alternative.
Yeah. And I feel that more and more patients are looking for different alternatives besides the, medication. I feel like nowadays more people are open to wanting this type of alternative. And we have a quick commercial break. We'll be right back, everybody. Thank you.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you for tuning back in, everybody. We are speaking with Dr. Manish Gupta. He is a board-certified sports orthopedic surgeon right here at 2001 West Sample Road, Deerfield, Florida. You can reach him at 561-314-7200. And the website is sportsorthocenter.com, also a satellite office in Boca Raton. And so, Dr. Gupta, let's talk a little bit about advanced techniques in robotics and surgery. What's the latest? What's going on with all this? I hear all these, robotics and all these amazing things going on. Can you share with us a little bit about how that would work?
Yeah, absolutely. Technology has always been an interest of mine, because I think as an athlete, you were always looking to get the cutting edge, the best racket, the best, golf club or whatever. And those are tools to, enhance your game. And I think that's the same viewpoint I have with surgery. It's my sport, it's my livelihood, it's my passion, and, it's my career. And, why can't I have the best instruments and the best tools in my hand to do the best job that I can?
I like that.
So I think that's what led me down the path of how do we incorporate technology. Because I've always taken the thing that I don't want to be the last adopter, but I also don't want to be the early adopter. I want to see where it kind of mends in, especially being a community-based surgeon and things like that, or a doctor. So robotics, I think, has come by because of what it can do for preciseness and being more accurate with the data that you get. A lot of surgery before was taught by our mentors. It was a feel, and you studied the anatomy, and you looked at certain instrumentation, especially in orthopedics, to do and replicate what you had learned, and then you add your own experience to it. But now robotics, what it does is it becomes more of a checkpoint, and it allows you to be more precise. So those calculations, those things that you were sometimes getting by feel, now you have a reason and numbers next to it. And I think, and that technology is evolving, because as AI, artificial intelligence, comes in, we're getting so much data from all this information that we're able to capture that we may be able to predict certain movements. And so we may be able to, do robotic surgery in the sense where you have a robotic arm where it can work as fast as what you're thinking.
Wow.
And I think technology will get there one day. And in some parts of surgery, it has. You know, in my practice, I use robotics to do hip replacements. I do robotics for, you know, knee
Nice.
replacements. I'm going to be looking at it for shoulder replacements as well. So you know, it's become a key part of my practice because of my interest in it. I'm not saying that robotic surgeons are the best surgeons. I'm not saying that.
Sure.
I think, but I think we have more data we work with. We're more precise, and I think it's going to come out and yield better outcomes. So
I like that.
so I think that's, and the way artificial intelligence is going, I think that's going to be an added boon to this movement.
agree.
You know, in different areas.
How long does it take for, let's say, a knee replacement or a shoulder replacement? I heard they're doing them now much quicker than what they did years ago.
Yeah, you know, I think it all depends, and I've always taken the view that, you know, doing it quickly is not always the best.
Okay.
What you need to do is you need to use the correct amount of time to have the best result,
Sure, of
right?
course.
So somewhere of a balance. But having said that, with these techniques and with the, you know, minimally invasive options, you are getting, you know, cutting down anesthesia time. You're getting more, you know, precise.
Right.
You don't have redos and things like that. So I think it's not the same as it used to be. You know, we used to have big open surgeries before because that's the way it was taught, and that's the way.
Right.
But it's evolved, and now we have better instrumentation. We have better, you know, techniques and better outcomes based on those, so that you can take more of a less invasive approach.
And when you do, let's say, a shoulder or a knee replacement, what types of material is used to replace? I'm just curious.
Yeah,
What do they
you know, so
use?
they're biocomposites of, you know,
Okay.
of that's going to evolve into even more. But we use metals that are, you know, friendly to the body,
Okay.
that usually, you know, make up and they're composite metals, right? So a little bit of titanium, it could be steel, it could be this, but you know, that's bio-friendly. But now I think what's going to happen in the future, is going to be more natural, you know, materials like that are biocomposites. You know, so they will truly feel and look like, you
Yeah.
know, actual, you know,
Amazing.
you know, tissue that you're replacing.
Amazing.
So.
And I heard or I read a story, or I don't know, maybe in the future one day somebody in California can be performing a surgery, somebody, let's say in Florida, just with robotic down the road. I'm not saying
Yes,
now,
so
but
so the experiments are,
potentially,
yeah, exactly.
right?
The
Like,
experiments are
I was
going
reading
on.
an article.
Yeah, the experiments are going on right now.
Yeah.
In that regard.
It's
You know?
amazing.
And as a matter of fact, I was part of one where we were looking at how we could, through voice commands and through, you know, finger motion, could be the haptic technology and different things, you know, tell
Wow.
a arm to perform that stuff.
That's amazing.
And I think parts of it can be done right
Okay.
now, but I think the totality of it
Sure.
probably is not there. But, you know, like it said, we didn't go to space all of a sudden. And,
Right.
You know,
It's a process.
It's a process. So, and like I said, with artificial intelligence, I think there's going to be a big jump in these areas.
Oh,
and,
yeah.
and, you know, right now we have these glasses now coming in where you can, you know, get 3D pictures of what you're
Right.
operating, and you know, so all this technology that's going to,
So amazing.
with the help of artificial intelligence, going to be able to make sense of it and then incorporate it into what we're doing.
I love that. It's only going to enhance.
I believe so.
I believe too.
I don't think we need to be scared of it. I
Right.
think we can embrace it
yeah.
and do it properly.
I agree. I feel like it's going to enhance that. I think you're involved in 3 FDA-approved medical trials. Do you want to share with us about those medical trials?
Yeah, so, you know, it's an interest of mine to be part of the research community.
Nice.
You know, so I've done it since my fellowship when I was in, you know, at Union Memorial Hospital in Baltimore with Johns Hopkins. And, you know, these trials are really in the realm of regenerative medicine.
Okay.
Using stem cell therapy, using all these different
Nice.
biologics. And, you know, we have one for the knee coming up where we'll be looking at it where will be cartilage that's damaged. So instead of going for a replacement right away, can we do some stem cell therapy
Amazing.
through surgery to help you keep your natural knee. So that's one study that's coming in. It's a study from abroad. Actually, can't speak about it too much.
No, it's okay. Yeah.
But it's in the knee area.
Sure.
We had some study in the shoulder. We were looking at partial rotator cuff tears and how it could be affected and treated with using mesenchymal cells and using certain biologic agents to
Nice.
repair instead of actually going and doing surgery. Because I think one day we will be able to repair soft tissue through the use of, bio injections and things like that.
Amazing.
That can help.
Dr. Gupta, we actually have like 30 seconds left. This interview
Wow.
has gone so quickly. Do you want to leave our audience with any last-minute advice or anything you want to share with our audience in the next 30 seconds? Please feel free to do so.
Yes, one thing I will, I said, I don't want people to wait to, for injuries to get worse.
Okay.
I think they can trust their orthopedic surgeons that they're not going to always just, cut and operate on you. They will go through that picture where they'll diagnose you and treat you with all those non-operative things first, and then find and help you get better.
Absolutely.
So
Thank
I
you
think
so
that's the
much
message.
for all your information. We'll definitely have you back because I know you're doing a lot of other things in the office. So thank you so much for
It's
your
a
time.
pleasure.
I
Thank you.
appreciate you.
Thank you very
Absolutely.
much.
Have a great night, everybody, and we'll see you next week. Thank you.